So this is now normal flora. First thing you need to understand is what is normal flora. Normal flora is a population of microorganisms that are frequently found in the skin, mucus, and other sites in a normal healthy individual. They are found in association with humans and animals, and the majority of them are bacteria. So these normal flora do not normally cause infection. They have got a symbolic relationship with the host, and they are subject to constant change. They can be altered by antimicrobial agents. For example, let's say you take antibiotics. What antibiotics do is that they can go and start killing the normal flora of your GIT or your some other parts of the body. When you kill the normal flora, what will happen is that those other bacteria that can cause disease will start increasing in number, and they'll result into infection, which can be very, very bad. That's why taking antibiotics anyhow is not good. You might be thinking you are helping, you are worsening the situation, like penicillins. You can actually see the human body contains 10 to the power 13 cells, but it contains 10 to the power 14 bacteria. In other words, we are more bacteria than we are cells. That's the meaning, right? So we have got a lot of bacteria. Now, where do the normal flora come from? If you look at a newborn is sterile. Sterile just means that they don't have bacteria because in the uterus there is no bacteria. But after birth, newborns are exposed to flora of the mother's genital tract, the skin, the respiratory tract, flora of those handling him, and also the organism in the environment. So that is how we end up getting the flora. So what are some facts that we should know about normal flora? Can be a source of infection. It's actually opportunistic. It just finds an opportunity. It doesn't normally cause infection. And that will only happen with impaired defense mechanism, like especially in the immune compromised, or maybe something just wrong happens. They shift from the position where they're supposed to be and then they go to another location. For example, Staphylococcus epidermidis and E. coli. It doesn't cause UTIs anyhow unless it moves from its original location and then it goes to another location. Okay, that's when it can cause infection. They actually found in the skin, but if they find their way to the urethra, they'll cause UTI. And then some of the normal flora may cross react with normal tissue. For example, antibodies to various ABO group arises because of cross reaction between intestinal flora and the antigen of A and B blood substances. So they can sometimes get to react with our normal tissue components. This normal flora can as well produce carcinogens. So they may modify through their enzyme chemicals in our diets into carcinogens. E.g., artificial sweeteners may be enzymatically modified into bladder carcinogens. A carcinogen is a substance, organism, or agent capable of causing cancer. Affected by antibiotics, tissue damage, mechanical procedure, and diet changes. So these some factors can get to transform the bacteria and transform it into a carcinogen, and then it can cause cancer. But what are the benefits of normal flora? Number one, they help to synthesize and excrete vitamins used by the host. That is why when you take too much antibiotics, what will happen? Remember when we discussed in that was microbiology on the vitamins. You are going to be deficient in like vitamin K because vitamin K is produced by these bacteria. So when you're taking antibiotics, you'll be deficient in vitamin K. And what that means is that vitamin K is necessary in the making of clotting factors. So you will be easily bleeding. Okay, easily bleeding. Another benefit of normal flora is competition with pathogens for nutrients and colonization site. So instead of the pathogen coming to feed on the nutrients that are in our bodies or colonizing the area, the normal flora will be there and do not cause disease, because when the pathogens come there, they'll cause disease. The another benefit for normal flora is they act as direct antagonist against pathogen. In other words, their presence chases away pathogens, because if they are not there, that will now leave room for the pathogens to grow. And then they stimulate the development of immunological tissues. They will help tissue to immunological is just being able to respond to anything that is foreign. So they will help to stimulate the development of immunological tissue, those tissues that respond to foreign substances. And they stimulate the activity of the immune system by production of natural antibiotics, antibodies actually. So they help also in the production of antibodies, okay, which are natural. What are the overall effects of normal flora? Competition with the host for nutrients also. Bacterial synergism between normal flora and potential pathogen. Sometimes the normal flora can cooperate with the pathogens, and then now they overwhelm our bodies and then they cause infection. They have got also low grade toxemia. Okay. The meaning of that is that to some little extent they can produce toxic substances that can be harmful to our bodies. As well, they can cause endogenous disease and opportunistic infection. And some normal flora become opportunistic pathogens. For example, Staphylococcus aureus, it causes very bad infections, but then it's part of the normal flora. Strepto, Streptococcus mutans also causes very bad infections. Enterococcus faecalis, Streptococcus pneumoniae, Pseudomonas aeruginosa. These are all normal flora, but then they cause very bad infections if they find the privilege. So they are very bad. What is the role of normal flora in our body? Number one, immunostimulation. They help to produce antibodies. Number two, exclusionary effect or the vacuum effect. Protect from external invaders. Okay. When they are there, nothing will enter. Number three, they antagonize other bacteria through the production of substances that inhibit or kill non-endogenous bacteria. In other words, they are selfish. Anything that is not belonging to the cell, they'll produce some things to kill it. Thereby, they are defending us. Number four, they help in the production of essential nutrients like vitamin K and B. Okay, for example, E. coli help in the production of these guys. Number five, may be a source of opportunistic infection. That is another role in patients with impaired defense mechanism. Number six, they can stimulate development of certain tissues. For example, cecum and lymphatic tissue pairs patches in GIT and influence immunology of gut-associated lymphatics. Okay, so they can stimulate the development of tissue. For example, a cecum and lymphatic tissue. What is the relationship between normal flora and the host? The relationship can be neutralism, where two organisms live together and neither is affected by that. Another one is mutualism. Two organisms live together and both benefit. Mutual. Commensalism. Two organisms live together. One is benefited and the other one is not affected. And most of them are actually commensals, most of the bacteria. They will live in the body, but then we are not affected. And then sometimes this can be parasites. Two organisms live together. One is benefited, which is a parasite, and the other is harmed. The host is harmed. So synergism, sometimes two or more microorganisms may work together. They team up to produce disease that neither could cause by itself. Like the two of them, if you are alone, they can't cause any infection. But when they cooperate, they now cause infection. Okay. You can see that the parasitism is more harmful, and then as you get to go up, commensalism and mutualism is beneficial. What are the types of flora. You have got commensals, that these guys have got a natural relationship with the host. It's natural, and they are found in low numbers and has no benefit or harm only associated with the GIT. And then you have got the residents, which consist of relatively fixed type of microorganisms regularly found in a given area at invariable period. If it disturbed, they can reestablish themselves. Okay, they are more important. The residents, they are part of the body. They are residents. And then you have got the transient. This consists of non-pathogenic or potential pathogenic microorganisms that inhabit the skin or mucous membrane for hours or days. They establish themselves briefly, excluded by host defense or competition from resident flora. These ones are less important. They are just there. They are transient. It's like they are just passing. And then you have got the carrier state, potentially pathogenic, that are carried by the individual without causing disease. However, it is a source of infection to other susceptible, those guys that are non-immune. All right. For example, Streptococcus pneumoniae, Neisseria meningitidis in the throat of health individuals, they can be fine. But when they are in the those who are weak, immunocompromised, they can cause infection. Carrier flora are potentially pathogenic and are present without symptoms because the person carrying it has immunity, this same carrier state we have mentioned. Okay, and they are subject to constant change. Opportunistic flora, these guys can cause infection sometimes when the conditions become favorable or when they are moved from their actual location. For example, Staphylococcus aureus, Streptococcus mutans, Enterococcus faecalis, Streptococcus pneumoniae, Pseudomonas aeruginosa. And another thing is they can breach skin or mucosa. They can make these breaks in skin or mucosa. Okay. Not them really making breaks, but if there's a break in the skin, like after surgery or an accident or a burn, they can now enter the body and they can result into something very, very bad. And then bacterium at one site may be commensal. But if it goes to, maybe commensal, meaning that on that site it will not cause any infection. If it goes to another location, then it will cause infection there. The growth of commensals may put patient at risk. Broad spectrum antibiotics therapy decrease total number of bacteria in gut. So when you have got too many commensals, too many bacteria that are just normal, resident, they actually cause a risk. So when you use broad spectrum antibiotics, what we call them broad spectrum because these antibiotics, when you take them, they will kill all bacteria, whether it's part of your normal flora, it is harmful, they will kill all. But of course, they leave some. They don't like wipe out everything. The meaning of broad spectrum is that they don't choose what kind they can kill, but they don't terminate the entire number. Now, some of these bacteria they exist temporarily. The opportunistic guys exist temporarily. Why? They can be washed by hand wash or bathing. They compete with the resident flora, so they will be chased. They are killed by substances produced by resident flora, may not survive in acidic or alkaline pH of the body site, and may be flushed away by bodily secretions like tears, sweat, or your urine, feces. You see now what I mentioned about urine after intercourse. Okay, when you take a lot of water and then you get to flush your urethra, it can prevent UTIs and some other things. So how is normal flora distributed in the body? I remember this was a question in our microbiology. That was a microbiology quiz. Huh? Yes, I think you are going to have it. So how are they distributed in the body? Oh, external body surfaces contain normal flora. Remember external. The GIT is also part of the external environment because you can actually connect one end of the GIT to the other end of the GIT without entering cells. You move to the mouth, up to the anus, and come out. So it's considered external. So each site has got a type of bacteria that is predominant. It's not the same. For example, I've got the GIT, the mouth and the large colon, the conjunctiva, the urogenital tract, vagina, and distal one third of the urethra. Please take note, vagina, distal one third of the urethra. You know the meaning of distal? The end of the urethra where it comes out of the body. Just the distal one third. Because as you get to go inside, the more inside is sterile. It doesn't have any bacteria. So only the distal one third of the urethra has got bacteria and the vagina. The skin, including the external ear and the conjunctiva, has got bacteria. The upper respiratory tract, okay, that is starting from the oral cavity, the nasal pharynx, they all have bacteria. Not the lower respiratory tract. Internal organs are sterile at health, except the GIT is not sterile. Internal organs are sterile. Like, for example, the liver, it shouldn't have bacteria. Sterility or the absence of bacteria is maintained by the local defense mechanism, chemical substances in serum, that is in blood, and tissue, for example, the complement and antibodies, and then phagocytic activity of polymononucleus monocytes. Now, what type of normal flora is found in each site of the body? This is the question you need to know. So the GIT flora is similar with the oral cavity with two types of bacteria. This is just a general overview so that it will be easy for you to remember. GIT and the oral cavity is similar with two types of bacteria. Oral cavity is different from the GIT with one type of bacteria. The GIT differ with oral cavity by four different types. Meaning that in the GIT you have got four different types that are not in the oral cavity. In the oral cavity you have got one that is not in the GIT, but two are found in both. GIT is most contaminated with six types of bacteria. The female genital is the least contaminated. It has got only one type of bacteria. So this table summarizes the kinds of bacteria that are found in each location. You can see for the oral cavity, what you have is alpha hemolytic streptococcus. Okay, these are the streptococcus viridans and the streptococcus pneumoniae. And you also have Neisseria, meningitis. It can be also you also have Neisseria gonorrhea, but Neisseria, Moraxella, and Haemophilus. And you also have the aerobic bacteria, bacteroids. These are anaerobic; they don't love oxygen. Okay, and Clostridium, the Fusobacterium. If you look at the skin has got staphylococcus, those which are coagulase negative. Now, at this point, you might not understand. I can describe for you. When you get a gram stain is going to give you, if it is positive, then that is a gram positive. It is negative, gram negative. When you go to the gram positives alone, when you use a coagulase test, if it is positive, then that is the staphylococcus. Okay. First, what did I mention? If you go to the gram positives, if you use catalase, if it is positive, that is staphylococcus. If it is negative, that's streptococcus. If you go to the same staphylococcus, you use coagulase. If it is positive, then that is the staphylococcus aureus. If it is negative, then it is the others. Okay. So for this one, it is coagulase negative, meaning that it's not staph aureus, but others. So those others, we have got staph saprophyticus and staph epidermidis. So those are the guys that you can even hear from the name epidermidis, skin. Okay, and the strap saprophyticus. Those are found in the skin, and including also corybacterium. Okay, dipherium. And then you also have Porpion bacterium. It is only in the skin. And then you can look at now the other regions. Like in the genital tract, you only have one, the female genital tract, you only have lactobacillus. And this guy is found in the sexually active between 15 and 45. So you can see that in the skin, the predominant guys here are anaerobic organisms, and they are going to be found predominant in areas with sebaceous glands. And the skin has the rich resident bacteria flora, like 10 to the power 4, like that's 10,000 per cubic centimeter. And they exist as microcolonies. Okay. So what are the normal flora of the skin? The most predominant one is Staphylococcus epidermidis. But you can see you have got also cori. The way the question came was they said mention one example of a normal flora that is found in the ear, external ear. And you know external ear is part of the skin. So Staphylococcus epidermidis, cori, corine bacteria, propion bacterium, acnes, okay, anaerobic cocci, coliform. Now, if we say anaerobic cocci, this is not specific. There are a lot of anaerobic cocci. So these guys are not, they are less common in causing disease. Except Staphylococcus aureus, this guy can cause disease very much. Okay, that's for the skin. So the resident organism in deeper layers of the skin, permanent flora, if disturbed, they are going to reestablish themselves, not removed by routine hand wash. These are going to be there even when you wash your hands, and they are usually not associated with transmission of infection. Those are the resident ones, but the transient ones, these ones, the reason as to why they will not be washed when you wash your hands is because they are deep, but the transient ones are superficial and they are temporary, and they do not establish themselves if you disturb them. They can be removed when you wash hands, and they can transmit infection. What are the factors that are important in eliminating non-resident microorganisms from the skin? Okay, non-resident. Remember the non-resident, they are the ones that can cause infection. So low pH can eliminate them. Fatty acids like the sebaceous secretions can eliminate them. Lysozymes, you know this guy is produced actually from tears. Neither profuse sweating nor washing and bathing can eliminate or significantly modify the normal resident. We already mentioned that. What are the effects of skin flora? The benefit, it inhibits the growth of fungus that can cause arthritis foot. And then the harm is it produces the body odor, and then it can also cause acne, pimples, and it can cause some opportunistic infection. And then in the eye, specifically not the entire eye, just the conjunctiva. You know the conjunctiva is uh, when you look at the bottom of your eye, okay, you try to get your fingers and then you try to drop your lower eyelid. The red portion of the inside of your eye that we are going to see, that's the conjunctiva, that skin that is red. Okay, so that one is going to have bacteria because the internal eye is sterile, it doesn't have any bacteria. And the bacteria that we are going to see is also the same bacteria that is found in the skin, like Staphylococcus epidermidis and the corine bacterium xerosis. And then the ear, the external auditory meatus is part of the outside. The middle ear, because the ear is divided into three, external, middle, and inner. The middle and inner, these are sterile, they don't have bacteria, but the external is part of the skin. It has got this Staphylococcus epidermidis, corine bacterium, acid fast bacillus, okay, occasionally in wax. It's normal, non-pathogenic. Any skin has staph epidermidis, and please, this is a nice statement. Any skin has got staph epidermidis and corine bacteria. So external ear is part of the skin. Respiratory tract. The upper respiratory tract, that's the mouth and the nasopharynx, they are going to have bacteria. The lower respiratory tract, like the lungs, can't have bacteria. And the most common resident bacteria for the upper respiratory tract is Staphylococcus aureus. That's the most common in the nose, okay, and also vulvar skin. And then you also have Staphylococcus epidermidis because of skin, and corrine bacteria because of skin. The oropharynx has got gram-negative bacteria in hospitalized patients. Gram-negative, guys. Okay. And then the normal flora that is there is the majority is the Streptococcus viridans, or the viridans group of Streptococcus. You also have the commensal Neisseria, corrine bacteria, Moraxera, bacteroids, Fusobacteria, Veinolena, actinomycetes, spirochetes, but viridans is the most. The potential pathogens, most common, Haemophilus influenza and pneumococcus. And then the less common, Streptococcus pyogenes and Neisseria meningitis. They can cause infection in the oropharynx. And then the GIT, where you have got bacteria, you have got the mouth, the esophagus, small intestine, and the large intestine. Okay. So the stomach is sterile because it has got the acid. So the acid kills the bacteria. And the GIT contains many anaerobic gram-negative and enterococcus bacteria. Enterococcus, okay, bacteria, but it has got 6 types we need to know. So GIT has most anaerobic bacteria, highest, because there is no oxygen in the GIT. So the GIT bacteria, alpha hemolytic streptococcus, which is the viridines. Actually, when it comes to streptococcus, you can divide them into alpha hemolytic, beta hemolytic, gamma hemolytic. Alpha hemolytic, these guys will basically remove they show complete hemolysis, the breakdown of the red blood cells. Beta hemolysis is partial hemolysis, and then gamma hemolysis is no hemolysis. They don't break. So Streptococcus viridans and Streptococcus pneumoniae are alpha hemolytic, and then Enterococcus lactobacillus, which is found in the sexually active between 15 and 45, and then the gram-negative bacteria like the E. coli, Pseudomonas, and then anaerobic bacteria like the bactericides, Fusobacterium, and Clostridium. These are the ones that are found in the GIT as normal flora. Okay. So you can see this diagram, the stomach is showing all these bacteria, but we've said that the stomach is normally sterile because they are of the acid. The duodenum, you can see Streptococcus, Lactobacillus, jejunum and ileum, Streptococcus, Lactobacillus, Clostridium, bacterial dates, colon, also the same bacteria. So the concentration of microbes is going to be increasing as you are moving from the upper GIT going to the lower GIT. And then the feces, 1/3 of feces weight is actually bacteria, which is dead. And living bacteria is about 10 to the power 10 in number per gram of stool. So the normal flora have got anaerobes like the bacteroid fragilis, which is the dominant anaerobe. And then bifidobacteria, lactobacillus, and then the aerobes you have got E. coli and proteus. Genitourinary tract, in both males and females, the distal, 1/3 of the urethra, and then the vulva and vagina for a female. The inside of the genitourinary tract, like the kidney, the bladder, fallopian tubes, these are sterile. So what is the normal flora? For the vagina, the most common is lactobacillus. Okay. And then you also have the epidermidis colon bacteria, because the vulva is actually the skin. E. coli, enterococcus fecalis. Bacterium. Okay, this is not very important. But the distal urethra, take note, it has got Staphylococcus epidermidis colon bacteria mycoplasma species, because this actually part of the skin, distal, nearly coming out. Now, why is the female genital tract heavily colonized? Because it is short compared to the male, and the bacteria from the colon can actually, from the anus, it can easily come to the vagina. Okay, and that's a problem, because from there the vagina is just down, the urethra is on top. So if these bacteria go to the urethra, then they become a problem, because the vagina is not sterile, but the urethra is sterile, so they can cause infections like UTIs. Okay, this is why we find the flora in the genital tract is the same as the one that is in the colon. The colon flora and the flora in the vagina is the same. 10 to the power 8 per mil of flora is going to be found in vaginal secretion. So basically, that is it about normal flora. You can get to answer these questions for yourself. A resident normal flora is, let's see how many questions are there. Okay, let's try to answer them. Number one, a resident normal flora is microorganisms that have natural relation with the host, regularly found in a given area at invariable period, consist of non-pathogenic or potential pathogenic microorganisms that inhabit the skin. Which one can you pick as a resident? Remember, it's resident. Which one can you pick? Okay. So you can look at these questions. Which of the following is the most common bacteria in the skin? Look at that. Type of relationship between normal flora and host is. Beneficial effects of normal flora include. Which one of the following is sterile? Which of the following is not sterile? These are all exam questions. Which of the following anatomical site does not have normal flora? Which of the following does not describe the relation between normal flora and the host? Among the normal flora found in the vagina is, which is sterile? Which of the following is not a harmful effect of normal flora? Following are benefits of normal flora except. So that is it. Thank you so much.